Hi, I'm Dr. Claudia Kim. I'm a cosmetic surgeon here at New Look New Life. Today we're going to be talking about blepharoplasties. So what is a blepharoplasty? It just refers to a cosmetic surgery that is done on the eyes. So we can address the upper eyelids or the lower eyelids. So an upper blepharoplasty or a lower blepharoplasty. As we get older, we start to see signs of aging, whether we look kind of tired or our eyelids are starting to sag or the eye bags under the eyes are starting to become more prominent. The eyes are the window to the soul. So definitely we want that to be refreshed when it comes to addressing the whole facial aging. So we can divide that up into two parts, an upper blepharoplasty for the upper eyelids, and again, a lower blepharoplasty for the lower eyelids. So starting from the top, we start to see signs of aging where the skin starts to kind of sag and starts to touch the eyelashes. And so for a lot of women, they start to complain that they have makeup smearing or their mascara or their eyeliner that starts to smudge. And because the skin doesn't have that much space before it touches the makeup, and kind of creates that fold. And that starts to, some people can actually start to see hindrance of their vision because your skin is actually closing down like a curtain. In an upper blepharoplasty, so we can remove extra skin. We can also remove extra muscle if that's also what is causing the skin or the eye to sag. You can also remove a little bit of fat if the puffiness of the upper eyelid is due to extra fat. We tend to be a little bit more conservative with the fat resection for the upper eyelid, but if it is prominent, then you can do a little removal just to complete the picture. For the upper blepharoplasty, the incision is customarily in the crease of your eye, and depending on how much skin laxity you have, it will extend out past the corner and kind of become a part of the crow's feet, and we can hide the incision quite well. The sutures or stitches are removed after 7 days. You can do this under local anesthesia, which means that you are awake. You have local anesthetic called lidocaine injected in, and then after that, you don't feel anything for the procedure. Depending on what we do, can range from anywhere from about 30 minutes to about an hour, and the downtime is quite minimal. It looks scarier than you actually feel. Most people do really well with over-the-counter medications, but you can have bruising and swelling, and a lot of the times the bruising will resolve in about a week to 2 weeks, but the swelling can be quite persistent for several months. Now on the other side, the lower blepharoplasty, same concept where you do start to see the skin laxity or you start to see the puffiness or eye bags caused by fat. Now in some individuals, it doesn't have to present later on in life. There is some people who have genetic features where it just runs in their family and they've always had eye bags, and usually they'll report that they've had those eye bags ever since they were young. Now it does get worse with time just because the muscles in the lower eye tend to get weaker, and so those prominent fat bags or the eye bags can get larger with time. So the way that we perform a lower blepharoplasty, you will have to go to sleep for this because the incision that we do, or I personally do, is underneath. So when you kind of flip your eyelid where the pink mucosa is, the incision is made there, so there's no visible incisions on the outside. Now the lower blepharoplasty can be done with an incision on the outside, and it depends on the person. So if it is just a pure fat removal, there's no visible scars because the incision is on the inside. However, if you do have extra skin and you do need to cut out some of that extra skin, the incision will be on the outside, which is going to be right underneath your lower eyelash line. Obviously, we like to deal with the face and the eyes with the different components. So you have the skin, you have the texture, you have the volume. Now, if it is just purely eye fat bags in the lower eyelid, then just removal of that fat bag will end up giving you a nice contour of the lower lids. However, most of the time is not as simple. Now, some individuals, they have those fat bags, but they actually have underlying volume loss. So in situations like that, we do have to do a little bit of repositioning of the fat, or we take fat from somewhere else and actually graft that area. A lot of times you will need an in-person evaluation to really see what your underlying cause is and what needs to be addressed. Now, other modalities that we can combine, so with the lower blepharoplasty, you can take the fat out, you can add the fat out, you can rearrange the fat, or if you have a significant amount of laxity but it's not enough to cut out, you can combine that with laser resurfacing, where you actually pretty much kind of resurface the first few layers of the skin. That helps it tighten up, and usually people are complaining about, where they have like the crepiness under the eye. And so that would be a nice option to combine with the surgery itself with all these different laser modalities. Downtime for the lower blepharoplasty, similar to the upper blepharoplasty, where the bruising can persist for about a week to 2 weeks, and you can have swelling up to a couple of months. For your restrictions after surgery, obviously no exercise for 2 weeks, no intense cardio, things like that. You can pretty much go back to doing your normal activities after the first day, but again, it's advised against not to do anything strenuous that can potentially cause bleeding after surgery and prolong the healing time. What are the bad things that can happen after a blepharoplasty? Complications. Complications can be for scarring. You can have persistent swelling, or not enough fat was taken out, or not enough skin was taken out. If your surgeon takes off too much skin, then you can't close your eyes. So when you're sleeping, your eyes won't close completely. So the amount of skin also needs to be excised in a conservative manner, just so that you are able to close your eyes fully. Another complication that can happen with the lower blepharoplasty is if the patient has a significant amount of skin and you didn't secure that lower area there, you can actually have what's called an ectropion, where you can actually see the pink of the eye. So that's something that we are definitely trying not to do. So that is considered a complication. Other complications, which is a significant one, is bleeding after surgery. And so when you do have a significant amount of bleeding, that can cause compression of the nerves, and it is a medical emergency. So definitely be in touch with your surgical team, because if you have bleeding, then it needs to be addressed right away, or it can potentially cause blindness. And then obviously you can have the risk of blindness with a surgery like this. So be aware, do your research with the right provider to make sure that they are qualified in what they're doing. Another common complication that can happen is dry eyes. So again, it can, if you already have dry eyes to begin with, the surgery can potentially make your dry eye worse. So make sure you discuss that with your surgeon, and to just make sure that that is something that is the right procedure for you. Some people will need to address both the upper and the lower. Some exceptions to that case obviously is, like I said, if you are a younger individual and you just have isolated eye bags, then you can just do the lower blepharoplasty without addressing the upper eyelids. But most commonly, I feel like a lot of patients do end up having those changes to both the top and the bottom. So we will combine that. And again, if it is some other characteristics that you're unhappy with, like skin laxity or volume issues, then we'll also consider doing adjuncts such as fat grafting, fat repositioning, or laser resurfacing at the same time. Both the upper and the lower blepharoplasty is considered same-day surgery. Like I said, with the upper blepharoplasty, you're completely awake, or if that's something that you're really not comfortable with and you'd rather go to sleep, that's definitely an option. But if you are comfortable with just being awake, you can do local anesthesia and you go home right after. For the lower blepharoplasty, you do need to go to sleep, either sedation, just because you don't want to be aware when your surgeon is cutting you open in that lower eye, which tends to be a little bit more sensitive. And with that same, you go home right after and you rest at home. Another common question I get asked is, if I have eye bags, can I just get filler and just avoid the surgery completely? That question really depends on the patient. Now, if some individuals, if their eye bags are not as bulging out and if it's not as significant, and you have the volume loss or kind of the tight crease there, you can use fillers to kind of camouflage that defect. So since you have something sticking out, which is the eye bag, but you actually have volume loss, which is sunken in, you can use fillers to kind of blend out that transition so that the eye bags don't look as prominent. So it is an option for some individuals. However, you are masking the problem, right? Because the real problem is the fat bags themselves. So fillers are only temporarily camouflaging the issue, and some people are just perfectly fine with that. In some individuals, if the fat bag is quite prominent, then the surgical intervention is probably your best option. I hope this has answered a lot of questions that you guys might have about blepharoplasty. Stay tuned for other future educational videos.